Hi, I'm Jordan, and I'm representing Stillmark. As a startup based in Ann Arbor, we work closely with some of the most talented academics, entrepreneurs, and engineers to identify problems overlooked by the healthcare system and remedy them. It isn't healthy for society to have certain segments of our population who have families and loved ones disproportionately suffer from an ailment and yet not be able to access the resources they need to address it. That is why we aim to advance health equity by increasing the accessibility of gastric cancer screening, which would make earlier diagnosis and treatment more achievable. If gastric cancer were detected at its earliest stages, its survival rate could reach 75%. However, due to the lack of early symptoms and screening guidelines in the United States, most cases are diagnosed at advanced stages, lowering the survival rate to just 36%. Despite a low incidence rate in the US, certain populations, such as those with pre-existing conditions or a family history, are at elevated risk for the disease. The current gold standard for screening is the upper endoscopy, an effective yet invasive procedure that is difficult to obtain insurance coverage for. For many, the slim chance of identifying gastric cancer is not worth the stress and discomfort that comes with the upper endoscopy. A more affordable and non-invasive preliminary screening test that detects biological indicators of gastric cancer could address these issues. This test would identify individuals requiring further screening, making it easier for them to obtain insurance coverage while sparing the stress and discomfort of an upper endoscopy for those who do not need it. Numerous studies have shown that patients with gastric cancer show increased levels of molecules in the breath called volatile organic compounds, or VOCs. To detect these, our team has designed a compact breathalyzer that utilizes three components: a physical device to collect the sample, electrical sensors to collect and transmit data, and a machine learning algorithm to analyze and interpret the data. The breathalyzer design prioritizes portability, featuring a grip-friendly design with a cap, mouthpiece, relief valve, and check valve. The electrical component employs a multi-sensor circuit, utilizing low-cost gas sensors to measure the concentrations of 5 VOCs in the breath. This data is then transmitted via Bluetooth to a computer running a machine learning algorithm. The algorithm, based on a neural network model, predicts gastric cancer status from VOC concentrations, using existing patient data to either recommend patients for further screening or inform them that no additional testing is necessary. Recently, Stillmark has completed initial usability testing for its device, focusing on making the instructions for the device easier to understand and communicate, and optimizing the neck of the device to allow for constant airflow. Future plans involve larger population usability tests and extensive assessments of sensitivity, specificity, reproducibility, and promptness to minimize false positives and negatives and ensure time sensitivity. The team will also evaluate cost-effectiveness for accessibility and study how the device performs in environments with varying humidity to prevent circuitry damage. This comprehensive approach demonstrates a commitment to accuracy and accessibility, and we believe that given more time and resources, our device will save lives.